So what we'll do is we're just going to kind of hop into the next portion or our next speaker. And so I'm really, really excited to introduce one of our parents who we have worked years with. And her daughter, bless her heart, is 16 now. We have known her for many years. And what's really, really cool about Barbie and her daughter, I'll let her kind of tell a story a little bit for you guys. But her child did go through a pretty large surgery, and so what's really neat is that the surgery went well. She's doing well, but there's a lot that goes into a decision, and what and what does that decision look like, and the questions that you have, and how do you make the right decision for your child? And so Barbie's family really had to process all of that, and they did make the decision to go through with surgery, but again, it's not an easy decision, and it's a decision that a lot of parents question, and it does take them time to make these decisions. So I'll let Barbie kind of tell you about her story, and then if we have questions or anything afterwards, or if you have questions in between, feel free to unmute yourself, ask a question, or put it in the chat box, and I will definitely help process those questions for you. So again, here's Barbie. Thank you for joining us, Barbie. I appreciate it.
Okay, I'm nervous.
Don't be nervous. It's just us. It's just us. We love you.
Okay, so let's see. Where do we begin? We were diagnosed probably, well, at birth. She was born with the, what are they called? I can't think of it. The port wine stain on her forehead.
Sturge-Weber?
Yes. And the doctor that when I gave birth told me she has a huge birthmark, but it'll go away in a year. I'm like, oh, okay, no problem. I go to her primary care doctor, and as soon as he sees her, he says, why didn't you tell me about her birthmark? And I said, well, because the other doctor said it would go away. And he says, no, he says, I need you to go down to Valley Children's and I need you to do a CAT scan and an MRI. He says, I know what this is. And I was like, okay. Well, then I did all that. I came back to my doctor's and he hands me, kid you not, a pamphlet that big. And it said Sturge-Weber syndrome. So I went into mommy mode, went through the whole packet, which I advise nobody to ever do. And I panicked because it says that there was going to be seizures, delays. And then I was like, I don't know where to go from here. Well, he set me up with Valley Children's and I met with a neurologist there. We started, so we were fully diagnosed by 5 months. At a year old, she started having seizures. And from there, that's pretty much where our real journey began. We started going every time she had one because we didn't know what we were really doing. And then once we started getting the hang of it more, we had to learn to control them ourselves with the medicines they gave us. And we were learning, it was a learning process. Nobody had ever had epilepsy in our family. And if they did, it was uncles and aunts from years ago. We did the traveling to figure things out. Excuse me, decline. There we go. Am I back? Sorry. We were asked if we would like to do a surgery, and we're like, yeah, no problem, because it would give her a better life. And our first doctor sent us out, and she was just a little thing, probably no more than 5, and it wasn't able to be done at that time. So we continued on and we dealt with our day-to-day struggles with her learning. She didn't learn how to sit up, to walk, to do a lot of things that normal kids do. And it wasn't until she turned 12 is when we went to Valley Children's because she kept getting sick. We lived there practically. And they had a new doctor, and his name was Dr. Santos. he met with us and he says, have you considered having a hemispectomy? I'm like, no, what is that? He says, well, it's where we would disconnect part of the brain that was making the seizures happen. I said, no, we've already been told that it can't be done, that it wasn't it wasn't in the cards for us. He says, well, how about we do one more just to make sure? And me and Dad said, well, it won't hurt, even though we didn't want to have our hopes up. Well, then we did our testing. We did more CAT scans. We did a video EEG. And then, hold on. Okay. I thought I heard kids coming. And then he came in and he says, I see exactly where it's coming from. And it's not both sides, and it's not how they described, and it can be controlled, and it can be done by the hemispectomy. I said, okay, so now what? And he says, well, we have a few more tests we got to run. And we did those. And then within a month, I was talking to Dr. Sharma. She's wonderful. Their whole team is wonderful. And then we got our surgery date. And I've told Caitlin so many times, the day of surgery, I wanted to drive right on through and hit Mexico, hit somewheres, and not come back, because if I came here, I knew that was it. She was going to have to go in. But in reality, I knew that wasn't the way it works. The seizures would follow no matter where she was. So we drove in, walked her up, sat with her, and we had a remarkable team at the time, because we were being videotaped by Valley Children's to share our journey. And so I had them helping. They would come out and they would tell me, she's in the back, she's doing good, everything's going great. And then I would get texts that she was doing great. 9 hours later, they said, okay, she's in recovery. You guys can see her in a little bit, but be aware that there's tubes, there's this, there's that. And I'm like, okay, I can't do this. I don't want to see my baby hurt. They said, but she's better. We got it all. And I said, okay, I don't want to be away from her. So we went back there. We saw the tubes. We saw everything. We saw her at her weakest. And before she went in, I told her, Mommy's fought for you all this time. So after surgery, you need to fight and you need to come back to Mommy, because I can't do it. You have to do it yourself. And once the tubes were out and she was more awake, it sounds really gross, but they had given me that she might not talk for a while. She spoke, like, her words. They were, Mommy, I need to throw up. And I was like, I didn't know whether to put my hands out to her, like, okay, I'll catch it, or to just sit there and cry, because she spoke. And I'm like, this wasn't supposed to happen. You guys said. And they're like, no, we said that there was a chance. They got to give you the ugly with the good. And we took it. We held on to that. And we're like, okay, we're strong enough to get through this. And I knew that she heard me say that she needed to fight, and she's a fighter. She's always been a fighter. We did recovery for about a week, and then we were sent home because she was walking, she was talking, she was using the ladies' room on her own. She was doing everything, feeding herself, playing, sassy as ever. And from there, it was heaven, like in full bloom, because I did not ever think that it could happen. Here we are 3 years later, and she's remarkable. Like, she's everything that we want for our child, to not hurt, to not have a seizure. I could deal with delays. I could deal with the things that come along with it. It was just the seizures. They break your heart in a whole different way, because you can't fix that one. It runs its course. But now I'm a proud hammy mommy, and I love to say I scream it at the top of my lungs every chance I get. Ugh. I don't know, Kayla, more.
No, that's great. I mean, I think really, this session is exactly what you said, and just talking to other parents and letting them know that, these are big decisions that you're having to make as a family. And, unfortunately, you got this choice a little bit later on in Soraya's life, right? So she's
Yeah.
was, I think, 13, right? Ish, 12, 13.
12,
Um,
13.
and so, it just makes me think, if these options had been available earlier to her, if we had met Dr. Santos earlier and had some of these things, years prior, which, what would be different? What could be different? What would that look like? And I say that so that other parents can really think about, don't hesitate on having conversations about surgery options, because
No,
I
never.
mean, I say that in a sense of, always have those conversations with your doctor, because there may be things out there that you're not aware of, that could be options for your child. And to really make sure that you're talking to an epileptologist. And neurologists are wonderful. They have a huge part in sitting at our table and have conversations. But when you're meeting with an epileptologist, they are the specialist in really determining where these seizures are coming from, and what it's looking like, and give you all of the options, especially, with our neurosurgeons, on deciding, okay, this could be the best option for your family. The question that I have for you, Barbie, I think that a lot of people would be asking is, as a mom, and dad, like you and dad, what were some of the questions that you guys felt were really important, to ask the doctor before you decided to go ahead with this surgery? What were some of the things that you were processing?
Mine was more the outcome of it. What was she going to be like? If, and don't get me wrong, I'm happy with her whole everything, but I already had a child that had delays. I already had a child that had seizures. What if it didn't go right and something went wrong? What am I looking at here? Like, am I looking at the ugly part of it? It's, will my child be able to play again? Will my child be able to smile again? Will my child be able to talk to me again? Does it just take time, or is it a lifelong thing? Am I going to go from having this very strong little girl to having someone that can't communicate anymore? And I know a lot of families have that, where their child can't communicate with them. And see, for us, it was different, because we found out that it was holding her back from a lot. She wasn't able to develop. We just chalked it up to her development delays. She's a little lady, and it took her surgery to bring that out, for her to be a little woman. And
Can you give people, I want people to really see the difference and the jump in her abilities before and after surgery, because she, like you were saying, she did have some delays, but after the surgery took place, we started to notice a pretty big increase in her cognitive ability and her personality a little bit. And so can you give everyone just a little bit of a clearer picture on what it used to look like versus what it looks like now, and kind of the really cool things that she's able to do and talk about, and express, basically, that she wasn't able to before surgery.
She really does express herself. Soraya was always a shy little girl. If she knew you, then she would talk to you. She was tiny and frail. She didn't have much of an appetite, and she could not like just gain weight at all. We were stuck with the 12-year-old that only was weighing 60 pounds. Like, she could not move from there. We would get her to 61 pounds and we'd be so excited for that pound, and then bam, it was gone. We'd be back at 50, 55. And we're like, okay, we gotta figure something out. After surgery, her appetite grew. I mean, she was bring on the bacon, bring on the burgers. She grew taller. Her sassiness came out because she doesn't care who you are. She will talk your ear off because she just wants to know everybody. She's so friendly and outgoing, and she could sit there with the most tiniest person and just be like, what's your name? And how old are you? And before we were like, oh, she's shy, like she, because she would just look down at the ground and not like look at anybody. And we're like, no, you need to talk to people. And now we're like, okay, now you need to slow your roll because now you want to talk to everybody. So now it's more like, okay, now we need to teach about stranger danger. You talk to some people, you don't talk to everyone. If mommy's talking to them, then it's okay. But don't go around, being a Walmart greeter. Because she's just happy-go-lucky. And as far as her cognitive, I had a little 4-year-old. After surgery, we did a big jump to about, I think her highest level was 10. Mm-hmm. And then we just did another one, and our highest is 12. And we may stay there, we may not. I did a lot of processing on that because that's what I do. I process what she's going through to think of how that's going to affect her in the long term. Mine and Dad's thing about her surgery, though, was it released a whole new child, and we had to get to know this child because it wasn't the same Soraya that went in. It was a whole new baby. Like, she came out, she went in a little girl, she came out a full-on teenager, and we're like, I've even asked the doctor, can you please put it back? Because I don't know this child. Like, whose kid is this? Who'd you give me? They're like, no, she's perfectly fine. She's yours. I'm like, I know she's mine, but she's so different. Like, I don't know her yet. They're like, well, took time to get to know her when she was little. It's going to take time to get her to know her now. Like, and we do. Like, she cracks jokes, even though they're like old dad jokes. But to her, they're hilarious. And we just sit there and laugh at her because she has an infectious laugh. She's just totally infectious. Like, she can make you smile when you're feeling so sad. She's so in tune with everybody's feelings. And at the same time, she could be mad. Like, if you tick her off, she's mad and she lets you know. But if she's happy for the day, then we're like, oh, thank you, Lord, because her bad days when she's a regular teenager is too much. I mean,
well, I think the cool part is that, it unlocked, right, a piece of Soraya that was in there, but no one really had access to her, right? I mean, it's just, no. And the surgery was the opportunity to really, and there's no better sense to say this, but release kind of Soraya in a sense that she was able to develop all of these, different things that you weren't seeing before. And I think that that's really a cool part, I feel like, for other parents to sort of take away, like, what is it that we take away from making these decisions as parents? Because they're not easy decisions. You've got those fears and those worries of, well, if we do surgery, what if this happens? What if this happens? What am I going to be looking for? And like Dr. Sharma said a little bit earlier, it's a whole team approach. And so I always encourage parents, please ask questions, talk to your doctor, because you are very much a part of the team and the decision making on what goes on for your child. And I think that that's the biggest piece, that, you know, parents do have a voice. They have a voice in and a seat at the table, because we want you to be very aware of um, you know, the positives that can come out of a surgery option, but we're also going to let you know, hey, these are some things that we could experience, or that your child could experience. And in Soraya's case, my goodness, I remember her standing up out of the hospital bed and walking down the hallway. And I just remember everyone bawling, because that was such a positive effect that we didn't even think that that was going to be something that she could do.
No.
And then, you know, later on, as time kind of moved forward, you know, now we have this teenager that's just hilarious, that cracks people up, that smiles and laughs all the time, that, you know, asks silly questions, and has just this, like you said, infectious personality. And I think that that's really cool, because she's going to continue to develop that personality, and it gives us an opportunity really to, you know, be a parent in a different way to your teenager. You know, versus before, that wasn't an opportunity that you had.
No.
And you know, can you kind of describe a little bit to me, sort of what you feel some of the successes of making this decision? Did you talk to Soraya about it at the time, with her being a teenager at that point, or was the decision that you and dad decided to make together? What did that family decision process look like for you guys?
So she knew that we were going to do testing, and she asked if she was going to have surgery. And I try to take it upon myself to not be the mommy that lies to their kids, tries to not hide anything. I did let her know that if things go good and they look good, that she can have the surgery if she wants to, and then she won't have no more seizures, because she knew she didn't like them.
Right.
She didn't always remember them, but she knew the next day, and she would tell me, I had one, huh? And I'm like, why? She says, my body hurts.
Oh.
So I said, okay. I said, yeah, baby, you had a little one. I said, but it was just little. She says, but my body hurts, Mom. I'm tired. And she would sleep the day away, because I would just let her. But when surgery came up, I come from a very big family. I had my husband. I had all of our kids, which we have 8. Soraya is the 8th. She's the baby of them.
And she's the only one with seizures, right?
Only one.
Okay.
I had my mom and my stepdad, my dad at the time, and his wife, and my sister and my brother-in-law. I had us all, and I said, look, I know we all have issues. I know we all have problems, but I need you guys now. They're putting surgery on the table. So at that minute, whatever was said and done at the time was pretty much pushed aside, and we were all gonna figure this out if we were gonna go through with it. Me and Dad sat down with everybody, and they said, well, what are you thinking? We said, we want to go through with it, because for a mom and a dad to have a child that has seizures, it's okay. But when mom and dad have to go and can't be there no more, then it's taken upon the sisters and brothers and aunts and uncles and everybody else to step up. And they said, okay, well then what are you thinking? I said, I never want her to be a burden on anyone, because she's not a burden to me. She's my daughter. But to anyone else outside of the family, I don't know what you think. And to her sisters and brothers, I don't want them to continue on with their lives and then all of a sudden inherit their sister and getting ready to take off. And I've told Caitlin, I don't want them to sit there and say, okay, you know, kids, we're going to pack up our family and we're going to go to somewhere, Disneyland, Monterey, wherever. And then Sarai has a seizure and they're like, well, you know, we can't go now because Sarai had a seizure. We got to take her to the hospital. We got to make sure she's okay, make sure she don't hurt herself, make sure this, make sure that. And then it becomes an issue for them. So we decided the best thing would be this surgery. Hardest thing ever. It's not for everybody. Like it really is. Only the strong survive, because it takes a huge toll on your mentality, on your heart, on your whole body, because you're so exhausted already. And children and husbands, gotta love them. We decided, and like Caitlin says, you know, you have to be your child's biggest advocate. And I love that seat at the table that I still know I continue to hold when I go and see Dr. Santos. I know when I go see Dr. Sharma, if I have any concerns, they will help me through it. I'm not left alone. I never was. You know, after we decided on surgery, we went in and we're like, okay, we're ready. They said, okay, are you sure? I'm like, okay, well, now I'm second guessing it. Why am I not sure? And they're like, no. Are you sure? Because don't make a decision really quick. Like, never do that. And it's like, okay. So then, you know, they said, we'll talk about it again. And then I think it's like a couple of times you're supposed to ask. And we did. We're like, yeah, we're on board. They're like, okay, you know, okay. We'll see you in a couple days. I'm like, okay. And then we did it again, and we're like, we're on board. We're ready. They said, okay, you're scheduled. I'm like, why'd you make me go through this? Like, well, because we have to. Like, you have to make sure that this is the right decision. And it is. It was for us. And I'm happy with our decision. I'm happy that there's so many other options out there for a lot of families that can't have this surgery. So it's wild. I love it though. And they know I would do anything for them because they gave me the most amazing gift ever in life. Not even giving birth to my children tops this. Like, how can you ask for it? It can never be fixed. Like, this can't be undone no more.
Well, you know, I like what you said. I like that you said it's okay to continue to ask. It's okay to continue to have the doctor ask you, are you sure? And to take that time to process that, right? I mean, a lot of times, of course, the sooner the better for a lot of these surgeries, right? For developmental reasons, for a lot of different reasons. And of course, the doctors will tell you that. But what I heard you say is that our doctors specifically gave you that time to process your guys' decision as a family, and heard your questions and took the time to answer questions that you had, so that when you went into this surgery process, there weren't any questions that were left unasked, right? And to be an advocate, you know, for your child and ask those questions that you do have, even if you think it is a silly question. You know, there's no silly question. And so the fact that you felt comfortable having those conversations, ongoing conversations with our doctors, I think that's really something to be said. I think there are a lot of families who are scared to say something. You know, they're scared to say, okay, well, if I ask, this is the 5th time I've asked the same question. And, you know, what I've heard our doctors say is, that's okay. Ask us the question, because we know that there's a very small part of what you actually retain in the clinic versus when you go home, you're like, what did I ask? What did they say? I don't remember. And so, you know, being able to reach out and ask those, and being able to reach out for support. Can you give me a little bit of a picture on how important it is for other parents who are experiencing something that you guys went to, on what support looks like, and how that has been helpful for you as a family, as an individual, as a mom, and even for, Soraya as a teenager. What does that look like, that other people, let's say that they have no one else other than, they don't have any family around. What would be kind of some advice that you would give them as a parent, experiencing the day in and day out challenges that seizures present? What would be the advice that you would give someone?
Pre-surgery, my support was my kids, because once Soraya had more seizures than anything, I noticed a lot of family backed away because they were like, well, we can't ask her to come stay the night because we don't know what to do with the seizure. Okay, given. And it's not meant for everybody. Like I say, only the strong survive. And it showed me that my kids, who were older than her, but still young, under 18, they knew how to administer her medicine, how to count her minutes before they could give it to her, how to take care of her during a seizure if I wasn't home. Compared to some adults that I thought had my back. Like, I really thought, like, anytime I needed a good cry, I had a concern, I had just a broken heart from it, because, like, everyone knows it takes a toll. I realized that they weren't there like I thought. And for a while, I thought I was alone, other than my kids and my husband. I mean, my husband, he's her number one fan. So when she's hurt, he's hurt. After surgery, I had the doctors. We were still doing our video for Valley Children's, and then we had our interviews with ABC 30. And we found out that people that didn't even know us, they were like, oh, you guys are so strong. It's like, no, we're not strong. She's strong. We're just, along for the ride. And we found, I don't know how you say it, but we found like new family, new friends that they didn't understand, because I can tell Caitlin I understand, and she could tell me I understand, but our understanding isn't the same as if I were to tell Jessica, I understand what you're going through, because I do.
Mm-hmm.
I don't know who in your family is having the seizure, but I understand the seizure. So Caitlin is like so awesome, because she found a bunch of other mommies and daddies that have the same thing that I'm going through. Good and bad days. I just had a bad day, and Caitlin and our whole group listened to me just sit there and talk, and even cry, and whatever I needed to get it off my chest, to remind me that we are top-notch parents, because we can take the punches, we can roll with it, and we are amazing because our children make us amazing. I didn't know I had that kind of support, and now that I do, it makes it so much better, because I'm not alone. And Valley Children's doesn't leave you alone. Like, it's hard because I don't have to see them but once a year now. And I'm like, but I want to see you guys more. I'm used to seeing you guys like every 3 months.
Aww.
They're like, no, go away. We fixed this. You enjoy it. And then we'll see you in a year, and we'll tell you, you guys are still doing good. Go away for another year. But if I called and said, okay, I need to go in because I'm just having this moment that I don't know what to do with this and that, They would make an appointment and say, come on in. We'll sit here and hold you for a minute and then send you back out because she's amazing. It's like, okay. So, I mean, we just weaned off of medicine. She did end up with anxiety, but I can deal with anxiety. I have anxiety. Everyone in the world has anxiety now. Seizures, it was hard, but to know that we're no longer on seizure medicine, we're no longer having seizures. We have a flourishing little teenager. I couldn't ask for anything more. I mean, they have an amazing team. They had an amazing team following us. I mean, everything about everything is it's just black and white there. You can go in and tell them exactly how you feel. You can honestly cuss up a storm at them and they'll know that you're just being frustrated because nobody else is listening, and they are. Because I've sat there and tried to tell other doctors when we were sent out, like, oh, well, this is going on. No, it's not. Like, you're not seeing it. I've even yelled at some of the ladies in the ER because they're like, well, we didn't see her have a seizure. So are you sure? I'm like, I sure wouldn't be here. I would rather be at home eating pizza, watching a movie, not sitting here for 4 hours. Like, I know what I saw. And they're like, okay, we'll call your doctors and see what happened. And they'd weigh her and they're like, oh, well, she just gained, a couple pounds. It's a little off. So we'll up it and send you on your way. And it would go away for a while. But after every single medicine we took and it wasn't working no more, I'm glad that Dr. Santos was here. I'm glad that Dr. Sharma and her whole group were there. I'm thankful for Caitlin for always having our back. She was there to hold our hand the day of surgery, and she's there to hold my hand every day that I need her.
Well, thank you. I mean, I think, our patients are such a valuable process on, us as doctors and providers in the clinic. And I just think it's really awesome to be able to have that experience with all of you and to watch the process take place, right? Because it's so important to really process that. It's not something that happens overnight. And so to really just give you guys the opportunity to vent, to feel stressed out, to be okay with feeling that way, to be anxious, to be sad, to be happy. I think that's why, and Barbie, you were one of many people to push and really process why we needed to start our epilepsy support program. And I say that with a huge thank you from myself and from the hospital, in a sense, because it's families like you and patients like Soraya that we said, you know what, your child is seizure free. That doesn't mean that support needs to stop there, right?
No.
And so that's one thing that I would love to continue to stress to parents. Hey, if your child is seizure free, excellent. Don't stop getting support. Don't stop having a conversation about seizures and what that's like, because the more that we talk about it, the more that we process it, the more that we let other people know this is how it affects us on a day-to-day life, the more that other people are going to say, hey, I kind of sort of get it now. It makes more sense. And how can I help? Because I think a part of it is that there's still that stigma out there. There's still the part where we're scared. We don't want to ask. We don't want to be invasive and ask too many questions. But
I'm an asker. I
yeah,
have always
and
been
I think
an
that's
asker.
wonderful. Yeah,
Because you have to. When your kid, see, like I said, we didn't know what a seizure looked like.
Mm-hmm.
So when your kid's eyes are rolling to the side and they're twisting and if somebody else were to see that, they would say some ugly stuff, because I've been told ugly stuff for having this surgery for Soraya. Like I said, we were followed by Valley Children's, and we're proud to say that, because that video, I know that video is going to reach a family one day that's unsure if they're ready to have this surgery. And with just that video, knowing the outcome of it, I'm happy if it helps somebody.
Mm-hmm.
Our video on ABC 30, we posted on our timelines, everything. My family posted it because they're so proud of Soraya, but I got a lot of backlash for it. And ugly things were said to me. I was a barbaric parent. And I'm like, how dare you call me barbaric when you walk a day in my daughter's shoes after she's had a very hard seizure? Then call me barbaric for making the best decision for my child. Whether it was going to be the surgery, whether it was going to be putting the magnet in, whether it was going to be some kind of other thing that they were going to do. Somebody always has something to say that's ugly. And it was the way we handled ourselves during that time, because, I mean, one, we're parents and we could have said some ugly things back. Two, it was on ABC 30's page, so they're affiliates of Valley Children, so we can't do that. Everybody would see it. So we were like really polite about it, and we had to let people know, look, we're not barbaric. The surgery was maybe from the barbarian times. Maybe that's what you're talking about, because I'm not barbaric. My daughter's not barbaric. Her doctors aren't barbaric. They're helping my child. And if I think
it's part of that. I think it's part of the stigma, in a sense, of when we're talking about surgery options, people assume, right, that, hey, you're having a hemispherectomy, we're just going to take that whole part of your brain out, right? I mean, I think that's questions of parents that come in that are having that surgery. They ask that all the time. Well, does this mean whole half of my brain's going to be pulled out?
No.
And so I think that's what people need to know, is ask the questions. And even though we kind of giggle when we ask that question, it's a question that's still asked. And that's not the case. We know that's not the case. But just to ask those clarifying questions. And, we would much rather people ask, like, and I know for you, Barbie, and your family, you would much rather have someone ask you a question, right? Then make an assumption and make these awful comments about, how terrible of a parent you are, because we know that that's not the case. And we know that these decisions as parents are huge decisions that you're having to make. And, a lot of things that you're kind of having to process during that whole time are not easy. And so the fact that, you guys, you held it together in a sense of, people are thinking these things for me. This isn't a reflection on us or our family, because I think it's very easy to take all these things that are coming in, right, as, okay, if this is what people think of me, or this is what they're saying, then it must be true. And so you guys did a very, very good job of saying no, like separating, right, what people were saying versus what you were experiencing. And as being a parent, still continuing to be that advocate for your child, because your child is jumping leaps and bounds because of the decision that you guys made.
That's exactly what we do for her. And I don't regret it. Even if it would have came out that, she still had a few seizures, I still wouldn't regret it.
Mm-hmm. Because it would have been less than what she was experiencing, right?
Yeah.
And so, like we said, of course, the surgery options are, obviously, we want to decrease seizures, right? And cure them. But that's not always the case. And the doctors will talk to you about each individual situation differently, and allow you to process that information. But the fact of the matter is that she is doing so well. And your child has come back to you in a way that you never thought was a possibility. And by making the decision, the very difficult decision you made as a parent, because of the outcome, now your child is a 16-year-old, and
she's gonna go live with you, Caitlin.
Yeah, nope, I'm good. She would be so fun, though.
Send her back when she's 18.
I wouldn't even know what to do. I wouldn't even know what to do with a girl. I have 2 boys, so that would be definitely a different challenge in my neck of the woods. But you know, are you okay? Can I share the video? Can I pull the video up and share it so that people who don't know your story? Okay, let me see if I can figure this out.
She's funny. She can make you laugh at the things she says.
She's always worried about the other person. Even though she's going through everything that she has, she's worried about you.
She was born with Sturge-Weber syndrome.
Sturge-Weber, you have abnormal development of the brain, blood supply is affected, and so there are calcifications in your brain. They go in and out of the cortex.
That disease process can provoke seizures because it actually causes irritation to the brain.
And Soraya's life is waking up in the morning not knowing whether she's going to have seizure that day or not.
Some days she can go a week without having one. Some weeks she can have 3 or 4, and they knock her out completely. She's down for, 2-3 days after she has a good seizure?
A really hard one, yeah.
Like I feel them coming and I kind of shake. I feel better when it's over.
Then we met with Dr. Santos, and he just amazed us.
It changed everything because, you want your daughter to be okay.
Dr. Santos helps me.
And so after I looked at her case, I said, no, it doesn't really need to be like this. The only thing that the right brain right now is doing is, 1, cause the seizure. And 2, when it causes the seizure, it probably inhibits the left brain, which looks normal, to function. So I said, what if we could go in there and take out the right brain?
So there's a very systematic way we do it. We first start off with removing the temporal lobe, and then all the fibers that are communicating, we just go and we disconnect it. And that essentially stops the communication from the side that's firing off seizures to the side that's functioning and doing well.
And so for Soraya, yes, Mom told me, Dr. Santos, we're ready. After talking to you, I think we're ready to go.
The morning of, I just got her dressed and loved on her.
Mom said, Dr. Santos, you know what Soraya told me when she woke up this morning? She said, Mom, this is the day. And Mom said, what do you mean by that? What do you mean this is the day? This is the last day I'm going to have a seizure. That statement touched me.
And there are 2 surgeons working together, and we work together to minimize blood loss, but work quickly so that we could minimize the operative time.
In all honesty, it's just too emotional. Here I am thinking, okay, they're like really cutting into my baby's head.
She was stable throughout the procedure. We were able to do everything that we wanted to do. No complications.
They came out with these smiles, and they were like, we did it. And they got everything they wanted. They took care of what they had to. So there, I was just walking on clouds. They gave me normal when I didn't think it was possible. And I have my baby with no seizures. They did something that I couldn't do. Because in my weakest times when she was having a seizure, I couldn't fix her. And I couldn't help her, and I couldn't kiss that boo-boo away. And they kissed it away.
I would thank for the doctor and nurses, and they really helped me.
I'm so grateful and thankful they've done so much for us and for Soraya.
I think she's gonna do big things. I can't wait to see what she does.